Welcome to Amplifying the Patient Journey, a series in which we speak with both providers and patients about the clinical journey with a neurologic condition and what recent advances mean for patients, their providers, and caregivers. In this episode, Billy Irving, project editor with Practical Neurology, speaks with Richard Huckabee, a patient living with Parkinson's disease and a Parkinson's Foundation Aware and Care ambassador and research advocate. Mr. Huckabee is enrolled in the PD Generation Study, a national initiative offering no-cost genetic testing and counseling for people with Parkinson's disease. He discusses some of the barriers he faced in receiving a diagnosis of Parkinson's disease.
Thank you so much for joining us, Mr. Huckabee. Could you give us, please, a brief overview of your experience with Parkinson's disease, a timeline from diagnosis to treatment?
Sure. My name, as you know, is Richard Huckabee. I live in Ohio, right out between Cleveland and Akron. And I've had Parkinson's diagnosed since 2013, but it was a lot longer of a period for me to get diagnosed because in 2004 is when I first noticed symptoms. I was recently relocated from Ohio to Pennsylvania in 2004. And in Ohio, I used to belong to a Toastmasters group because I was working on my speaking, wanted to get into motivational speaking. So when I got to Pennsylvania, I went to a Toastmasters and noticed I couldn't talk. And I had a management position and I was managing people and my voice would get strained. And I would hold managers meetings and freeze and would have to cancel the meetings and have the rest of my notes sent on email. And I just couldn't understand what was going on with my voice. So I went to a doctor and explained my voice is strained, what's going on? And basically they said stress. They asked, what do? I manage people. And they said, you manage people, you got a lot of stress. That's what's causing it. Then I would begin to freeze when I'm talking to my supervisor and she would say, what's going on with you? And I was embarrassed to say I'm sick because I didn't know what was going on with me. So after the meetings, I would go to the emergency room. The emergency doctors would run all tests and tell me to go see my primary care doctor. I would go back. They started prescribing vitamin C and vitamin D and folic acid, just all kinds of things, but no one could find an answer. Then I started forgetting things, forgetting procedures. Part of my job was to train managers. So I knew procedures like the back of my hand. And all of a sudden, I couldn't remember simple procedures. I couldn't remember people's names. And I was making all kinds of mistakes. Then I got relocated from Pennsylvania to Ohio and had a bigger territory and a bigger responsibility. And then I started really messing up. Just couldn't understand what was going on with me. Now I had this huge territory and couldn't manage. So eventually I went to the doctor and said, what is going on with me? And they asked me more questions. And they said, you hike, because I told them I like the outdoors and hike. They said, oh, okay, you got bit then. You must have Lyme disease. So they prescribed steroids for Lyme disease. And I suffered for 6 months because I would tell the doctor, this is not working. It's making me feel bad. On steroids will make you feel good, but it's making me feel bad. The doctor said, just keep trying it, but it never worked. So the doctor in Ohio hooked me up to machines, had me do stress tests, still couldn't find out what was going on. Then finally, in 2013, my doctor was getting relocated to Florida. And she said, I'm sorry, I couldn't find out what was going on with you. I'm getting ready to relocate to Florida. So before I leave, I'll do one more thing for you. I'll send you to a neurologist. She sent me to a neurologist. And within 2 minutes in that office, he diagnosed me with Parkinson's disease. That was a 9-year journey. And I was devastated because in the meantime, I had lost my job because I couldn't function. And now I was being told in 2 minutes that I have Parkinson's disease. I was happy to know what I had, but I just couldn't believe it took that long to diagnose me. So finally I knew what I had, but the doctor didn't have much hope to share with me. He said, go to a physical therapist, a movement specialist physical therapist. And I was the one shiny star in that meeting because that therapist said it's a great time for me to start with her because she had a research study going on, drumming and dance research study. And that was the start of me finding help and finding hope. But it was a 9-year journey to my diagnosis.
What do you think made it take so long to be recommended to go to a neurologist?
Well, as I said, the journey really started to turn when I went to that research study. Because through that research study, I met people. And the people I met, we're still friends today, 11 years later. But through that, I learned of this organization called In Motion. In Motion, it was a community of people with Parkinson's, and they had exercise and they had education for you. And you could just sit and talk and discuss things. So in talking to one of the founders there who happened to be a doctor, I was telling her that it took me 9 years and I just didn't understand why. Well, this person I was talking to was a white female doctor. As she said, if you would have came to my office at 53, I would have saw you as a young Black male, and it wouldn't have even entered my mind that you could have Parkinson's because you didn't fit the profile. You're not an older white man stooped over. So that's probably why it took 9 years, and the light bulb went off in my head. You're probably right. She said, yes, we don't see Parkinson's when we look at you. You didn't fit the profiles. So don't be upset with the doctor. We just have to do more education for people and for doctors to know that Parkinson's is not one set of people. It's Black, it's white, it's female, it's male, it's young, it's old. So we just have to educate the doctors. But to answer your question, I didn't fit the profile, so the doctors didn't even have an interim because they were sincerely trying to find out what was going on with me.
And so you were a participant in the PD generation clinical trial. How did you hear about this clinical trial?
Well, once I did the research study early in my diagnosis, I got to the point where I got hooked on research studies. But getting the information is somewhat hard. I didn't hear about the PD generation study until 2023. And I know that it started in 2019. So I was wondering, why did it take so long? Because sometimes it's just hard to get information out. I heard about it when I started participating in a Learning Institute project that was put on by BIG and the Parkinson Foundation. They teamed up to bring Black and African American people with Parkinson's and their care partner to a Learning Institute to train them to be research advocates. So when I started planning for that training, I started hearing about PD generation. And I said, this is perfect. I didn't think about why hadn't I heard it before because I was hearing about it then. And I took action and went to my doctor and talked to my doctor about getting involved in the PD generation, but his office had suspended it at the time, which worked out for me because the Parkinson Foundation themselves took me through PD generation. But I heard about it when I was planning for a Learning Institute with the Parkinson Foundation and the organization called SIG.
And could you tell us a little bit about your participation in the trial and what was it like to receive genetic testing and counseling for your Parkinson's disease?
Yes, I was really excited about this process because PD generation will test my specific DNA to see if I had one of 7 genes that will indicate possibly Parkinson's disease. And this interests me because my grandmother had Parkinson's disease. Now, I have Parkinson's disease, and I have a son and a daughter. And I was wondering if they're going to get Parkinson's disease. So when I heard about this gene study, I had to hop on it because I wanted to know for my family and for myself. And then what was really attractive about any research study is but particularly this one is up front. They told you, you will get the results. Like I said, I've done many of research studies. One of the main concerns is I don't get the results. But with PD generation, they were giving me the results. I was happy about that. Then not only on top of that, giving me the results, they would have a counselor get a hold of me and explain the results. So I was going to get counseling and explanation and be able to ask questions. And then my wife could join me, so she joined me. So it was just a great experience. They sent a kit to my house, and I had to open the kit, go through the process of swabbing my cheeks, and then sealing everything up and mailing it back in. And then within a couple of weeks, I got the results. Then a couple of weeks later, they had me set up with a counselor to explain everything on Zoom. So it was a really good experience.
And as you mentioned, you didn't fit the typical profile of a person with Parkinson's disease. So it's important for people who might not fit this profile to join these types of studies to expand the diversity of their participant population pools.
Exactly, because I'm a Parkinson advocate and I speak at a lot of support groups. And this is one thing that I've added to my talk. You have to get involved in PD generation. And I always bring it up to people of color, like at the Learning Institute that we went to, which composed of historically the first group of all African Americans at this Learning Institute. And we definitely talked about PD generation and just about got everybody involved in it because we need diversity in research so that we could receive treatment that's basically geared towards us because everybody with Parkinson is different and sometimes you need a little different treatment. Everyone doesn't have the same treatment, but you have to do these research studies so they can get the data, learn, and see what fits us better.
Exactly, that's so important. And could you outline for us like any benefits that you've experienced as a result of your participation in the PD generation trial?
Yes, and I tell everyone it's definitely beneficial to participate in these trials because for one thing, it's free. It's free therapy, and you can't beat that. Then number two, you get that information. When my test came back, I learned that I didn't have any of the genes. So I was happy about it because then I could tell my parents that it wasn't because of your mother. It wasn't because of my grandmother that I caught this. And I could tell my kids, I don't think you're going to get it because I've had it because I don't have any genes to pass down to you. So that was a relief. So it was happy to get that information. And then to get that counseling where the person actually talked to you in person, or in this case on Zoom, explaining the whole procedure, what it means to you. So it was a great experience.
And do you have any recommendations to give to others who might have just been diagnosed with Parkinson's disease?
Yes. One thing I like to tell everyone that receives a diagnosis of Parkinson's disease, you have to be your own health advocate. You got to advocate for yourself. And in advocating for yourself, you got to get education so that you know what to do. And then you'll know how to better proceed. And getting involved in research study is one way to advocate for yourself, especially this PD gene study, because you need to know if you have one of the genes that could lead to Parkinson's for your own benefit, or you don't have any of the genes, but you need to know that. So you need to be an advocate for yourself, get that education. And then I always talk about other things that they need to do, like exercise and nutrition to improve their Parkinson's disease, because I'm one person that's definitely have benefited from all these studies and exercise because it was a point where I was falling, I couldn't drive, I was losing my balance all the time. I was in bad shape. But because of these research studies I've been involved in and exercise, I've started to improve because I started to get the information. So you got to be an advocate for yourself. I went from 4 pills a day to 5 pills a day, back to 4 pills a day, down to 3 pills a day. So now I'm on 3 pills since 2019, instead of going up as the protocol would state. I'm going down because of exercise, because of education, and because of involvement. And research study is the key factor in getting involved.
I'm so happy that you're improving and that the exercises are helping and the treatment that you received through the trial. Do you have any other comments about your experience or about the study or in general?
I would say getting involved, getting around people can only help you. And when you do one thing, it leads to something else, which leads to something else. And it's all going to benefit you. So I like to tell everyone to stay positive, because I've learned through classes that I've taken that really with Parkinson, there's always hope. It's not a doom and gloom situation. It's a hopeful situation. But you have to get out and do things. You have to have movement. You have to get involved. You have to get around people. You can't isolate yourself. So I like to tell everyone, let's start with this study. Let's start with the PD gene generation study, because it can lead to a lot of other things. And this is free. There's no medication involved, because some people are afraid that if they do a study with medication, it'll have an adverse effect on them. I let them know there's no medication. And when you get the explanation, see, when you do this study, you'll meet with someone who will take you through the consent form and explain everything to you. And like I said, I was fortunate because I got to go through it with the Parkinson Foundation themselves. And then it was a representative from the Parkinson Foundation plus a doctor who was involved. Dr. Chantel from Morehouse, she took me through it. And they explained that at any time you're doing a research study, you could opt out if you wish without any repercussions. So that's something that's great to understand. So I would tell everyone, let's just get involved and let's do our part. And you're helping to find a cure, possibly. You're helping to find a therapy that might benefit you. And it's all going to be beneficial.
Absolutely. Thank you so much for your time and talking to us today, Mr. Huckabee. I really appreciate you coming on and talking with me and sharing your experience.
It's been my pleasure.
Thank you to Richard Huckabee for sharing his knowledge and experiences with our listeners in this episode of Amplifying the Patient Journey. And thanks to you, our listeners. Be sure to visit practicalneurology.com for more podcasts in the neurology field.